Hi,
Hi.
my name is Gerald.
Hi.
I'm the pharmacist here.
Nice
I'm going
to
to be
meet you.
going over your medication today, okay? You mind if I have a seat?
Please.
Okay. So basically the point of this consultation today is just to go over some important things about your new medications, just to be sure you have a good understanding of how you take it when you come home, okay? Before we begin, could I just verify your name, please?
Oscar Sanchez,
And then your date of birth?
83158.
Perfect, thank you. And any new allergies to any medications?
Nothing new, no.
No? Okay. Do you have any past allergies or?
I have an allergy to Motrin.
Oh, allergy to Motrin. Okay, yeah. Yeah, I do have that here. Perfect. Okay. So, I understand that you were seen today for some chest pain, right?
Mm-hmm.
Oh,
I
okay.
have some severe chest pain.
Severe chest pain. How's it? Is it relieved now, or?
It's a lot better now.
A lot
yeah.
better?
Mhm.
Perfect. So basically, let's go over that medication first today. So the doctor prescribed you famotidine. That's going to be a tablet, 20 milligram tablet. It's going to be by mouth twice a day. So usually patients take it 30 minutes before their meals. You can do it 30 minutes before your breakfast and 30 minutes before your dinner. And some common side effects of the medication can include some GI upset and some nausea with the medication. Do you have any other questions or concerns for this medication today?
The pain was just really severe. Is there anything else that I can do to help that it doesn't come back?
Yeah, yeah. Do you take what kind of food do you eat?
A lot of Mexican food.
A lot of Mexican food?
Mm-hmm.
Yeah, so the thing is with Mexican food is sometimes it can be really fatty or really spicy, which can actually cause you to have those symptoms. So I do recommend to try to limit those foods or try not to eat those foods, as well as try not to have big meals. Try to have smaller meals throughout the day. So because usually what your body does is it produces a lot of acid when you take those kinds of foods, which is why you're experiencing the chest pain.
Okay.
Also, another kind of thing that may contribute to it can be smoking. So, do you smoke or
A little bit.
A little bit, yeah. So, you want to watch out for that one too, because that can actually worsen your symptoms too.
Okay.
Okay. Does that sound good?
Mm-hmm.
Okay. And then just to make sure we have it down right, your famotidine is going to be for your
For my chest pain.
chest pain, yeah, for your heartburn. You want to use this for your symptoms. And do you know how you're going to be taking it?
I think you said 30 minutes before food, twice a day.
Yeah, usually before the bigger meals of the day, so I do recommend to take it before breakfast and before dinner.
Okay.
Okay, sound good?
Mm-hmm.
Okay. So the next medications we're going to go over with you today is going to be the medications for your blood pressure, okay? Because we noticed it was a little bit high coming in, so we'll just get right to it. The first medication is going to be your atenolol. It's going to be a 25 milligram tablet by mouth once a day. You can really take it any time of the day you like, and it can be with or without food. With atenolol, it does work better without food, but if you find that it does upset your stomach, go ahead and take it with food. Some common side effects of the medication can include some tiredness and dizziness, as it does lower your heart rate, so just watch out for that. If you feel really lethargic, you want to be sure to let the doctor or call 911 just in case it's too low. Okay. And also, of course, with this medication, it's really important to take it daily just to have the full benefits of the medications and the rest of your other blood pressure medications. Next blood pressure medication today is going to be the hydrochlorothiazide. It's going to be the water pill, as patients usually call it. It's going to be 25 milligrams, 1 tablet by mouth daily. Okay. With this medication, it's just like atenolol. You can take it anytime with or without food. But with this medication, it can cause you to urinate or go to the bathroom more frequently, so it might be better if you take it earlier in the day. Another side effect of the medication can include sun sensitivity. What that basically is, it makes your skin a little bit more sensitive to the sun. If that occurs, just wear long sleeve clothing, sunscreen, or just try to stay in the shade. Okay? And with this medication, it's also normal to experience some dizziness since it does lower your blood pressure. So you definitely want to get up slowly and just try to watch out for any dizziness symptoms you might be having. Finally, you have your lisinopril. Taken this medication before?
I have, yeah.
You have in the past? Okay, so we'll just go over this one briefly. It's like the others, 1 tablet by mouth daily. Some common side effects to watch out for can include a dry cough. If it becomes persistent over a prolonged period of time, you can go ahead and let your doctor know and switch out the medication for you. Okay? And a more rare side effect of this medication can include angioedema, which is basically swelling of your lips or your face. If that occurs as well, just let your doctor know you can stop the medication. Okay. Of course, what's most important about these blood pressure medications is to take them each day, just to have the full benefits. You can actually take these all at the same time. There's no interaction really between all of the medications. And you know, what's also really important with these medications is you want to actually monitor your blood pressure just to make sure you're doing really well with the medications. The goal for you is to be under 140/90. And you know, some other things that can help lower your blood pressure can include your diet. So also lowering any salty foods. You know, try not to drink any alcohol, and you know, just try to exercise at least 30-minute walk across the week, just to have the full benefits of your medications. Do you have any questions or concerns?
So before I was brought in here, I was on Procardia, so I'm not going to be taking that anymore.
No, so that's actually why you're having the hydrochlorothiazide today. Basically, it's a lot cheaper instead of the Procardia, so it'll be a lot easier for you to pay for the medications instead of paying for like a high expensive brand name medication that might be just as effective as the hydrochlorothiazide.
That's good, because I've had a hard time paying for some of them.
Yeah, and that's the thing. Yeah, of course. So even though you might want to buy the medications all the time, and you have to take it all the time, and it's kind of, with this hypertension, it's kind of like a silent disease. So it's really important that you do take the medications continuously, because you never know when you're going to have any complications of the disease. Even if it's a high copay, I really encourage you to recommend to take it all the time. Okay. Any other questions or concerns today?
No.
No? Okay. And so just want to be sure that you do want to take these medications daily, with or without food. Most importantly, is just take it continuously. Okay.
Okay.
So that was a lot of medications for your blood pressure. Do you mind just repeating back some of the most important things we went over about those medications today?
Okay. So it's important that I take them. Silent killer.
It's important.
And then the water pill you said I should take in the morning, because it can make me go to the bathroom more. And that I should be monitoring my blood pressure at home.
Yeah, perfect. Yeah, and then and it is okay to take all of these medications at the same time. Most importantly, like you said, is just to take it each day. And usually, when you do monitor your blood pressure you want to measure it in the morning, preferably when you wake up. Just have an accurate reading there. Okay. So I was looking through your profile here, and I noticed you also take some medications for pain.
Yeah, I take Tylenol for my back pain.
For your back pain. Okay, so be sure to discontinue that medication. The doctor gave you a new prescription for Tramadol. It's going to be 50 milligrams every 6 hours as needed for your back pain. So usually with this medication, it can cause drowsiness while on it, so I recommend to take it tonight, see how you do on the medication first before you try to take it throughout the day, and especially before you're going to be driving or working. Okay. Also with this medication, it can include an upset stomach, so I do recommend to take it with food. It can also have a side effect of constipation. If it becomes severe, like you haven't had a bowel movement within a few days, let the doctor know. Okay. Just know that with this medication, there is a warning from the government regarding abuse and addiction potential. So just want to inform you of that you just be careful relying on the prescription too much. But yeah. You want to just go over that one really quickly, just to be sure you got it?
Okay, so I'm taking Tramadol for my back pain. Can take it with food, but if I notice any constipation, then I should call my doctor.
Yeah.
And then don't take it more than I need to because of the risk of becoming addicted to it.
Yeah. Your other medications, you want to be sure to take each day, but this medication, of course, it really is as needed every 6 hours for your back pain.
Okay.
Perfect. Finally, your last medication here today is going to be the Lipitor. It's going to be for the cholesterol. So with this medication, you just want to take 1 tablet by mouth daily. Usually patients taking it at bedtime, but really any time of the day that helps you remember to take your medications is fine as well. There's no drug-drug interactions with the rest of the medications. Also with this medication, you want to be sure to avoid drinking any grapefruit, cranberry, or pomegranate juice while on the medication, and to watch for any signs or symptoms of any kind of severe muscle pain, or even really dark urine or yellowing of the skin, which may indicate some liver injury with the medication. Okay. Any questions or concerns for this one? No? Okay, and then you just want to go over it briefly?
Okay, so this is for my cholesterol. Can take it whenever. And then I should look out for any yellowing or like dark urine or muscle pain.
Yeah, perfect. And then I want to let you know that for these medications, there are actually no refills for the medications, because you should follow up with your PCP because I'm pretty sure they want you to see how you're doing on the medications, how you're tolerating, if you're having any side effects to the medications.
Okay.
Of course, if you happen to miss a dose, like you happen to forget, just take one as soon as you remember it. But if it's close to the next dose, like within a few hours, just go ahead and skip that dose and just continue with the next new dose, okay? And of course, it is important to keep these medications in a cool, dry place. Usually recommend keep it in your medicine cabinet or your pantry or something like that too. Finally, so for these medications, it also helps with non-pharmacologic treatment too. So you want to basically, with your diet, try not to have any too many high fat or a lot of spicy foods. Try to spread it throughout the day and try to limit the salt intake, just so you can, it's better for the problems you're currently experiencing in the past. Okay. Just to make sure, because we did go over a lot today, do you mind repeating some of the stuff we went over?
Okay, so I got a new prescription for my chest pain, famotidine, I think, yeah. And then I have three ones for blood pressure, and then tramadol is for my back pain.
Mm-hmm.
And I'm taking Lipitor for the cholesterol.
Mm-hmm.
And I'm gonna follow up with my doctor in about a month to see how it's going.
Yeah, and perfect. That's and with those medications, it's really gonna help your symptoms. Just be sure to take it as prescribed.
Okay.
Okay. Any other questions or concerns for me? No. Okay. And if you happen, just feel free to give us a call. Okay.
All right, thank
Okay.
you.
You have a good day.
You too.
Okay.
Yeah. What questions or concerns do you have for me?
I don't think really any. It's just a lot of meds that I gotta stay on top of.
Yeah, and that's why the doctor only gave you a month's worth just to see how you're doing on the medications, but they're going to be really beneficial for you, and it's going to be really great for your health. Okay. Of course, if you do have any more questions or concerns, feel free to give us a call, and we'll, of course, love to help you. Okay.
All right, thank you.
Of course. You have a good day.
You too.